This month's scientific fiasco is the importance procedure presented as new. As you know, I serve on the scientific board of the Chest Wall International Group. Every month, some publications are sent to me for review. In recent months, I want to share these articles with you in a language that everyone can understand. That's why we started the Pektusname series a few months ago. But this month, I was handed such an article that I was not only surprised, but also a bit embarrassed, to be honest. This article from Montreal supposedly describes a new surgical technique for Pectus arcuatum. They have called it the minimally invasive hybrid technique. So both a small incision from above for cartilage resection and sternal support with a nosbar were performed. But there is a problem. We actually published this technique 11 years ago. We named it in honor of our late professor, the Onan procedure. In fact, there is even a black ribbon in the introduction of the article due to the passing of our professor, Ahmet Ona. In 2014, at Porno İzmir 9 Eylül, in the method we applied to 8 patients, the protruding cartilages on the manubrium sterni were first removed superiorstally, so these cartilages. Then we applied a wedge osteotomy to the sternum. That is, we removed the protruding part of the bone. Afterwards, we placed a nosbar from below to correct the lower part. We performed reconstruction with titanium mesh and screws for cartilage stabilization. In other words, we applied correction of the combined deformity with combined surgery. For the first time in the world, it was minimally invasive. The scar was small. Patients were discharged in 3 to 5 days. No complications were experienced. Our patient satisfaction is also 100%. Now let's turn to the 2024 Montreal article. The same technique, almost identical. Such situations can occasionally occur in the scientific world. But this technique, this contribution, this solution was developed in Turkey and entered the literature under the name of our professor, Dr. Ahmet Ona. It is our duty to keep the scientific memory alive and to show gratitude. If you want to see this hybrid approach proposed to correct Pectus arcuatum for the first time, look not at the 2024 article, but at the Ona procedure we published in 2014. This month's Pektusname was a bit reproachful, but some things need to be reminded, with respect, with pride,